House Call. Today we're joined by Dr. David Hryvniak from UVA Orthopedics to speak to us about a common issue causing runners a real pain. Let's start with plantar fasciitis, right? And what causes that?
So the plantar fascia is a thick, non-elastic band along the sole of our foot. And it's important. It helps form our arch as well as helps support and propulse us forward when we walk and we run. So what happens with plantar fasciitis is it gets inflamed and partially torn and can become really painful for people.
And so pain, I imagine, is one thing to look out for, but are there certain symptoms runners should look out for?
So people usually describe a pain in their heel. Some people have described it to me as a sharp knife in their heel. Usually worse in the morning. The first few steps out of bed can be real painful for these folks, and then it gets better throughout the day.
And is it something initially you want treated, or are there things that we ourselves can do?
So certainly there's things like icing, anti-inflammatory stretching that are helpful that you can do at home. But as physicians, we like to add on some extra conservative measures to that.
I'm sorry, go ahead.
So physical therapy is usually very helpful for that. Also, we can do injections, shockwave therapy. There's a host of things we can do, including changing your running shoes, adding inserts, bracing. There's a lot of different things we can try.
And is there a point where surgery becomes one of those options?
So I always tell my patients it's an option and we should keep it in the back of our mind, but what we're hoping to do is avoid it. And for the majority of these folks, conservative care works just fine.
All right, so let's talk about some proactive steps, pardon the pun, you can take. And I know there's a runner's clinic coming up that maybe people can learn some things about.
So we have a clinic at UVA called the UVA Runners Clinic, and it's the only clinic in the area that's for runners, and we're all runners. All the physicians there are runners themselves. We're all experienced runners and board certified in sports medicine, and we want to keep folks out there on the road, and that's our goals.
And we know that this is a community that certainly takes to its running, and there are no lack of options and scenic options at that to do that. So.
That's true. As a runner myself, I love when we can get people back over these injuries and get them back out on the roads.
All right, Dr. Hryvniak, appreciate your time tonight.
Thank you for having me.